Hi, I'm Kimon Krenz, and today I will give you an insight into our work on measuring environmental exposure that we have done over the past year in Bradford, together with John Wright, Rosie McEachan, Kuldeep Sohal, Ashley Dhanani, and Laura Vaughan, which we will replicate in Tower Hamlets. And in addition, I will provide some insights into the spatial analysis work that we are going to do during the next year, which also builds on this previous work. Just to give you a background of where we are coming from, where you live impacts your likely life expectancy. So if you live in a most deprived area, your life may be 15 to 20 years shorter on average than in a least deprived area. And these most deprived areas often experience several unfavorable environmental conditions. So this can be bad air quality, lack of green space, bad housing conditions, or the number of roads accidents. And this is an important aspect of the relationship between urban exposure and health. And during the last decade or so, this is also increasingly recognized by, for example, the WHO, who in the last year published a report titled Priorities for Urban Health, where they highlighted that a clearer picture of the association between urban exposure and health across the life course is needed. And one of the reasons why we haven't understood this linkage well is A, of course, these are very complex mechanisms, but B, the available data in the past hasn't been on the level of detail or spatial resolution that is needed to understand exposure at an individual level. So here, for example, we can see the difference between the widely used DAFRA air quality data, which is at a 1 by 1 kilometer resolution, and next to it, a much more detailed small-scale air pollution data set from the Bradford Council. And we can see that not only is it not showing a comparable picture, but it's arguably unable to capture spatial differences. Another problem is the way how the built environment is conceptualized and used in health studies. Often we see studies that use areas of aggregation that treat space equally within a postcode or buffer zone. And the built environment here is in a way seen like a container where everything is the same, which of course may not be the case. And we address this issue by using large-scale individual health records from the fantastic Connected Bradford platform, which links individual health information, education, social care, and crime data, among others, across all citizens in Bradford. And one of the components of this large data set is address information. These are collected by GPs frequently and are part of a person's GP record. This means we can track a person's home location through time. We utilize this address data as a starting point for the interaction with the environment. And we measure interaction with various domains in a person's environment around the address and link it via this address to the health information. So just to give you an idea of how this works, we take your address location and then we measure, for example, how long you would walk through the built environment to get to the closest green space. And we do this simulating your interaction with the environment from your precise home address. And for this, we have defined 9 different ways in which this kind of interaction could take place. So either directly at your address, at the street in front of your address, at your building block, at the shortest path from your address to an urban feature, or to all urban features in your vicinity, in a catchment area, or if we talk about air quality or greenery, we also use simple round buffers, but we also use these buffers along a path or along a catchment area. In effect, our approach should be seen as a toolbox or like a Swiss Army knife, which we can use to capture environmental exposure. We also incorporate something that is termed distance decay, which is often used in transport research and basically a function that accounts for the decreasing effect of an interaction with increasing distance. So if you go frequently to a shop, you're more likely to do this if the shop is within 10 minutes rather than if the shop is 14 minutes away from you. Basically, the further away something is, the less likely you are to go there frequently. And we aggregate this information for every address, and then we link this to historical GP address information. In Connected Bradford, for example, we have all address records for every registered citizen for the last decades. So we know exactly how long a person has lived at an address and in which order, so we can track through time their environmental exposure. And we do this for 11 different environmental domains, such as air quality, road traffic, green space, public transport, etc. And just to give you a really rough idea how this looks like, we aggregate this for every address, and then we can visualize this, of course, to get an idea of how the environment differs according to a specific area. So here, for example, is an indicator describing the level of air pollution. Then we have the number of cars passing through a street. We have information on the level of greenery. We have information on the access to green space. We have information on how close you are to a bus stop, how close you are to a fast food outlet, how many and how diverse shops are in your vicinity, the degree to which the environment is walkable, how central you are to other things in the city. We also have information on built form. So, for example, how high your residential building is. And we also have information on indoor characteristics, such as how big your flat or house is. And we can use this to, for example, create a synthetic person and describe how the environment of an average person in that city looks like. And we have done this for Bradford. So here we used Samina, a 12-year-old British Pakistani girl. And what we found was that Samina is closer to fast food outlets than she is to public parks or gardens in Bradford, which is an interesting insight. And this method is reproducible because we have used datasets that go back until 2013. This means we can reproduce these environmental indicators for every year in the last decades. And this can also be linked to any British longitudinal cohort survey if address data is accessible. And for those of you interested, there's a much more detailed description of this method in our recent publication linking the urban environment and health. So how does this now feed into our ongoing and upcoming work in ActEarly? We have divided the next months into several work packages. Some are carried over from the previous year. And what we try to do within every work package is to have a comparative approach, which includes both Bradford and Tower Hamlets. But one of the biggest obstacles is, of course, the lack of accessible GP level health information in Tower Hamlets. But we are currently looking into replacing this with alternatives. And I will now show you one slide for the first 5 work packages so you get an idea of what we're doing in more detail. The first work around fast food exposure and childhood obesity is using Vaughan and Bradford's birth cohort data. There we have information from roughly 6,000 children for which we can use data on their weight and the address through time, so we can see their exposure at home, and we know also to which school they go. This means we can compute their likely route to school, and then we can combine exposure to fast food outlets at their home from the journey between home and school and around schools through time. And by doing this, we can then identify a potential linkage between exposure to fast food outlets and childhood obesity. And what we've already done is ground truthing our fast foods classification with the help of a research assistant in Bradford. There, our RA went to 7 high streets in Bradford and evaluated whether our classification is actually representing reality. The second work package is around the topic of healthy schools. What we're doing for residential addresses can also be reproduced for any address type. So we are reproducing this for schools in Tower Hamlets and Bradford, and the idea here is that we create a similar set of indicators for every school and then classify kind of the environment of the school and link this to, for example, data from See Happy, which is a measure of appraisal of mood states. So in effect, we know how happy the children are and how this links to the environment of the school they go to. Then, if we produce this kind of work for addresses in both cities, we can start to combine these in what we termed layers of spatial inequality. We can start to characterize how, for example, the city's average ranks and how certain layers of inequality multiply. So we might be able to identify areas that, very much like my third slide indicated, have several of these unfavorable environmental conditions. And if we link this then to health information, we can investigate whether there are direct linkages between so-called layers of spatial inequality and various health outcomes. Another work package is concerned with the mapping of early childhood systems. Here we are interested in identifying barriers and map access and availability of early childhood services in Tower Hamlets. So this includes, for example, opening times of child services, but we are also interested in seeing where there are barriers in the built environment that might limit access. So one example for such a situation would be here, a relatively inaccessible bus stop in Poplar that is only accessible through a long staircase and located on a very busy motorway. And then last but not least, we are looking into relationships between air pollution and respiratory diseases. This is a causal inference research design where we are again utilize house move information to see whether asthma episodes increase or decrease depending on the level of air pollution at your home address. So this is pretty much what we are currently working on and what we are going to work on. And I'd like to conclude and thank you for your time.